publications in review in clinical anesthesiology for postgraduates, and also textbook of anesthesia for technicians. Welcome, Dr. Sanish. Over to you.
Dr. Anil Kumar, MRS Professor from Department of Anesthesiology, JSS Medical College. He has got so many memberships and leadership activities. He is the editor for Karnataka Anesthesia Journal, associate editor for Journal of Evaluation and Medical and Dental Sciences, reviewer for so many journals, and he is a founder secretary, All India Difficult Airway Society, Mysore, treasurer, Indian Society of Anesthesiology, executive member, Indian Society of Critical Care Medicine, Mysore, instructor, BLS, ACLS, ITLS, IRC, and BCLS, and CCLS. Coordinator, BSc Allied Sciences, JSS University, 2011 and 12. Member Secretary, CPR. Invited faculty at various national and international scientific deliberations. Member, IMA, ISA, ICA, ISCCM, AORA, IDA, ISNACC, AOA. Research and publications, he has got plenty of publications, and he has written few chapters on the books also. You are welcome, Dr. Anil. Your topic is quite interesting. We'll see how we can go about it.
Thank you, madam, for the wonderful introduction. When the topic was given, I was wondered how to present this topic. Very difficult to read, understand, and I've made an attempt, and thank you to Dr. Sanish has put a good foundation for my topic. I bring greetings from JSS Academy of Higher Education and Research. Ours is a 1,800 bedded hospital, catering all specialty, super specialty, including organ transplantation program. Ours is an institute with the highest number of ICU bed under single roof. We have got 163 bedded ICUs. How many of you are not using AI in your daily routine? Is somebody there in the audience who is not using AI? The Google Lens, which you use routinely to identify an object, or which tells everything about the object, including the price. That's the very simplest example of AI in routine use. The second is, if you type my name in your WhatsApp thrice, my name is Anil, the next consecutively after 10 days, when you try to type word nil, it automatically predicts Anil. So that predictive technology is nothing but the AI. We are so much utilizing the technology of AI without knowing it. Now the topic given to me is how AI is utilized in preoperative medicine. I've made an attempt to understand what is AI. Before that, I don't have any disclosures or conflict of interest regarding this particular topic. To define AI, it is basically a study of algorithms or flow charts. It is as simple as that. To give a machine's ability to reason and perform higher intellectual functions like problem solving, identifying an object or the word, or a decision making. When we teach the machine or the computer to think like humans, it is called as artificial intelligence. In medicine, particularly in the field of radiology and pathology, it is widely used from past 50 years for diagnostic modalities. In therapeutic and intervention, it is extensively used in the cardiology and surgery. To understand AI better, we need to understand certain terminologies and the subsets or the subfields of AI. To simply define AI, it is just a program or the flow chart devised by the human. It is called as handcrafted thing, which can sense, reason, act, and adapt. If you remember these three words, it gives a meaning of what is AI. The subset of AI is machine learning. What is machine learning? If machine starts learning itself, the food for that machine is the data. If you go on feeding the data, the machine starts analyzing it, it processes the data, it also gives interpretation of that data, it also identifies certain pattern in that data, which the human minds also cannot think. That is called as machine learning. The deep learning is a subset of machine learning where a large volume of data, even more complex data, the machine can think, it can analyze, and it can also find out the association between various variables. That is called deep learning. The next aspect of subset of AI is robots. Let us understand in my next few slides how robots are utilized in anesthesiology. You all may be using the Alexa from Amazon, the Google, and Siri from Apple. These are all what is known as natural language processing. Suppose if you don't know the language of a patient, you can just open the software in a Google, and it can translate the patient language, which helps us to assess the patient in a pre-anesthetic evaluation. Even you might have gone to other countries where we cannot read, suppose Chinese. If you take your mobile and just scan, we can read that particular text in our own language. That is called as the natural language processing. Then something called computer vision. We are teaching the computer to look the world how we are seeing it. Let us see how it is utilized in anesthesiology. As a few slides about machine learning. Machine learning allows programs to learn, detect the data without explicit program. This is most important. We create certain flowchart, certain algorithm, but the machine starts learning itself. By the end, if you see the result, even we cannot think that it is a drawback because it gives a result, it does not tell why that particular result has come. There is a limitation of the machine learning. The three subsets, the machine learning once again is divided into supervised learning, unsupervised learning, and reinforced learning. In supervised learning, it is a task-driven process by which a flowchart is trained to predict some pre-specified output, such as identifying a stop sign or identifying an animal in a picture. This, how we can utilize is, if you give a picture of a man, the machine can tell, it can predict the difficult airway. That's how it is applied in anesthesiology. Then, this is a particular article which describes about the output of machine learning. Coming to the unsupervised learning, it refers to an algorithms identifying certain patterns or a structure within a given data set. Suppose if I given a data of 100 patients, it tries to identify how they are different, how they are associated with each other, depending upon your inputs. Reinforcement learning, a very important learning. This is a mechanism extensively used in anesthesiology. It refers to a process by which the flowchart is asked to attempt certain tasks. For example, deliver an inhalation anesthetic agent, and to learn from its subsequent mistakes and success. Let us understand this with a biological analog. This operant condition is extensively used. What exactly happens here is, assume that rat as a machine. When you put the rat in a cage, initially what will do? Unknowingly it touches the liver and it gets its food. When it starts repeatedly doing, the rat learns that if it presses the liver, it is going to get its food. The results are twofold. One is the rat has learned by pressing the liver, it is going to get food. It also learns whenever it wants food, it is supposed to press a lever. This is what happens in a reinforcement learning with the machines. So when you feed data, so much of data, the machine starts learning itself. Coming to natural language processing, Sanish has put a good the basics for this. We use as an anesthesiologist this in pre-anesthetic clinics in language translation as a smart assistant to analyze the documents. For an online searches, you don't know about something about some disease, suddenly the patient is on table. Just search. This is an application of simplest application of AI in our clinical practice. It can also be used for predictive text. Then come to computer vision. What is computer vision? If you put a high resolution camera in your operating theater, not the regular CCTV, with a depth analysis camera, we can also find out the real-time person, how much the particular individual has got exposed to the radiation. That can be detected by these cameras. It also helps in automatically adjusting the music volume during the clinical portion. Suppose some case is on, some light music is there, patient is in a critical state, some arrest something, automatically the music gets adjusted or it gets dimmed. These are certain applications which are used in anesthesiology. It also helps to predicting what is the remaining duration of surgery. One very interesting thing is, it also can identify whether a surgeon is a very good surgeon or a suboptimal surgeon. It also applies to us. It observes how I intubate. These cameras observe how much time I am taking, how many attempts I have done. See, so it helps us in giving a feedback and it helps us in learning or relearning. All this information could decrease the patient waste time, prioritize the instrument cleaning based on what is next needed across all the ORs and minimizing the delays. It also helps in analyzing the ultrasound images for neuroaxial and intravascular procedures. It acts as a second eye for syringe selection. See, when a high resolution camera is there with the depth assessment, see this in particular images, it helps to identify the object, what drug you are taking. Thereby, it helps us the prevention of the looking alike and sound alike drugs. It also it reads, if you put a radio frequency labels on that, it reads what exactly is there in a syringe. It also records what was the volume that was there in a syringe and how much volume you have given to the syringe. The total recorded version will be given to a physician to recheck. The other applications include the depth of anesthesia monitoring. It is very difficult to remember so many waves are there, alpha T blocker, and different patterns. The AI helps, it recognizes the pattern and it remembers. Whenever this is applied, this software is applied to the AI, it particularly tells this particular pattern is going, with this particular pattern, whether patient is awake or anesthetized. It helps to identify the potential of specific frequency bands in assessing the effects of certain drugs. Coming to the automated anesthesia, suppose if you want to sedate. In complete automated anesthesia, we don't have particular role except owning the machine. You have set the BIS monitoring, for example, you want a BIS somewhere between 40 to 60, you have set, and you are connected to the patient. This is again connected to the monitor or the software. This software reads what is a BIS value. Depending on that, it allows the infusion system to pump the drug. So it constantly maintains certain level of BIS. That is called as automated anesthesia. So you can use, depending on your institute or the protocol, you can use whatever the monitor. You can use the vital signs, you can use the clinical signs, blood pressure, depth of monitoring as a control systems. And ultimately, the proven areas are propofol, remifentanil, muscle relaxants. These are all been controlled with these automated systems, and mechanical ventilation is also allowed. And how to wean from the patient. It weans. It automatically sets the ventilatory parameters depending upon the patient's trigger. It is also used in event prediction and ultrasound guidance. The deep learning produces a color overlay. See, just I highlighted the color just to make sure that you all should look at my slide and understand there is some important point. The similar thing happens whenever the sonoanatomy picture comes, the machine highlights the color. That is done by a human, but later on the machine learned itself when to highlight, what kind of structure it need to highlight. See this particular video. See the machine, this is a sonoanatomy picture. Sorry. This is sonoanatomy picture. The color is overlaid by the software. So it helps to identify what is muscle, what is artery, what is vein. So it helps anesthesiologists to identify the particular structure and guiding the needle. This is an application of the AI in clinical practice. It also helps to predict us the opioid dosing, identifying the patient who may get benefit from preoperative consultation. Already I discussed about operating room logistics. Coming to robot, there are 3 types of robots which is used. One is pharmacological, mechanical, and cognitive. Mechanical robot with this particular paper from BJA and from anesthesiology. The Kepler intubation system from Canada, the investigators from from the Canada, they use this system where these are the joysticks, simple arm of the robot, and they use this video laryngoscope to intubate the human. This was the first robotic intubation of a human done in anesthesiology. That is usage of the robotics, mechanical robotics. 2 years before, that is in 2010, the surgical Da Vinci system, the routine what surgeons use, they made an attempt to do fiber optic intubation with these Da Vinci systems. Though it was not so popular, the Hemobot was a robot which was used for IV cannulation. The second is the Magellan system is extensively used for ultrasound guided robotic system, which itself can inject a drug, identify the structures. So these are the robots that are already used. Coming to the pharmacological robot, there is a MechSleepy system which is extensively used till now. There are 3 infusion pumps, one for neuromuscular drugs, one is from propofol, other is for ramifentanil. Coming to the cognitive system, each institute should develop their anesthesia information management system, which helps us to learn about the compliance and drug reactions. AI is used extensively teaching and learning, as Sunny said. To take home, the current focus of AI within anesthesiology is not on replacing clinician judgment or skills, but on investigating ways to augment the clinician's help or the clinical decision making. Thank you for patient hearing.